I'm Dr. Tiffany Crider, or Dr. Crider. So a little bit about myself is I grew up here in Lebanon, so it's awesome to be back and to be able to treat patients here. And then I went to Ohio State for my undergrad, and I went to medical school in South Florida and North Southeastern. And now I am very excited to be back in Lebanon and treating the patients where I grew up and the families that I get to see every day in the community. So the types of patients that I see here in Lebanon are pretty much the range from anybody because I'm a family medicine doctor. So I see newborns, I see older patients, I see patients who have diabetes or pain, musculoskeletal issues. I also specialize in neuromusculoskeletal medicine for a year, and so I get to see patients that have musculoskeletal issues as well. The neuromusculoskeletal medicine, I did an extra year for fellowship in that, and I specialize in osteopathic manipulative treatment, so OMT. And essentially that means that if you come in and you have a neuromusculoskeletal issue, I can evaluate it and I can also come up with a plan to treat it. And often that includes using my hands as a form of manipulation to work on aligning bones, softening muscle, work on ligaments, fascia, any of the tendons that seem to be tight, and I can help to get the body to relax so it'll encourage it to realign on its own and hopefully take care of some of the pain that you're having. So it's a nice way to adjunct it without using medicine, or even with medicine if we need to do that too. But it's a great help for a lot of our patients. Yeah, if you kind of take a little bit of what you think the chiropractor does and a little bit of what you think a massage therapist would do and a physical therapist and you kind of put them all together, that's kind of what I'm doing with my hands is I'm working a little bit in all of those ways. I would say the osteopathic technique has a slightly different philosophy than each of those, but overall our goal is to get the body to holistically do what it's supposed to do and what it wants to do. And usually when we're out working hard or we're sitting in our car driving every day doing the same thing, same motion, repetitive motions, the body kind of gets stuck in a position. And so my job is to encourage it to go back to that better alignment that it had to start with. Yes, I am accepting new patients. I am pretty new to the Lebanon office, and so yeah, we have spaces for new patients and I'm always happy to see new faces.